This is a section of the spine to check the range of motion. It's okay to do range of motion visually, but sometimes need more objective finding. One of the easiest way to do, especially on the cervical spine, will be using this device. So having this device on the back of the patient's head, ask the patient to bring right ear to the right shoulder, and you can see right where the midline is, which is about 35 degrees. Bring it back to the neutral, bring back left ear to the left shoulder. Again, on the left side, it's about 45 degrees. Go ahead, bring in neutral. You can also kind of check it by having a patient go ahead and flex and then positioning the ear to just do the flexion, bring it up, and then extension, and bring it back. When you're checking for the upper cervicals and the lower cervical, it's a little bit difficult to really monitor like where the ear is, because sometimes in the ear on the upper cervical, for example, using a goniometer here, what you can do, you can kind of start it in the straight line and then go look up. And the ear, if you're looking at the reference to the ear, it's almost like a 90 degree. But then it's not 90 degree at the rest of the neck. So make sure when you're checking for the cervical spine, either you're checking for the upper cervical, or you can do also just starting this here, and then lower cervical, go ahead, look up, extension, lower cervical to kind of see what the degree is. So this degree is right now about 45 rather than 90 degree at the upper cervical right here. So this is a few things that you can do. Rotation is a little tricky in a way. You can have this patients right here and have the patient to rotate to the right. So look over right shoulder and see, you need to kind of see from the top that what's the degree is. So it's about 65, look straight ahead, and then look to the left, and then 60. Using a goniometer, look straight ahead. With a goniometer, you'll be looking on the top, and then look to the right, and then it's good to kind of look at the point in the nose is. So one of them will straight, and then the other one will point to the nose, and then you can kind of determine how many degrees it is. Look straight. Another device that it's usually being used is a clinometer. So these are the kind of device that you can use. For example, it's good to use, patient kind of look on the side, actually turn your whole body to the side. And then you can actually have the two spots. So if you're looking at a C7, like a cervical spine, you can have it on one device on the top of the head, the other device in C7, so almost like C1 to C7, and look down, and then it will give you two different numbers of how much degree, and you subtract a bigger number, a smaller number from bigger number, and that will give you isolation on the cervical spine flexion. And then you can also do the same thing going to the extension. So you can kind of look in an extension and see how much degree that there's extension is. So these are all different devices that you can use for the cervical spine range of motion. You can apply this concept to the rest of the spine. So you can use the goniometer, you can use the different tools to get objective finding. Always try to find an objective finding rather than only using subjective finding.
Okay, so one of the ways that we can assess scoliosis is using the scoliometer here. Basically, you're going to check the degree of rotation at 3 different levels here. So above the shoulders, below the shoulders, and then at the iliac crest. And then looking on here, you can see that degree of deviation as we kind of rotate.